So I've been thinking, and I've been having like a really hard time dealing with crisis. And when I say crisis, like when my clients are like breaking down or having an anxiety attack or anger outburst or something really emotional is going on that kind of feels crisis like, I find myself struggling like with the words to say, what do you do? And I know, we learn grounding techniques and things, but it's like in the moment, handling the crisis can be almost overwhelming, and it makes me like stuck. And it makes me question myself as a counselor. It's like, do I really know what I'm doing if I can't help a person that's in a crisis? Like, my client's having an anxiety attack. Why can't I figure out the right words to say? It's really concerning me, and I'm really having a hard time when I have lots of clients right now that are having these really big emotional outbursts. And a lot of the times I feel like I'm not saying the right things or that I'm not doing the right thing. So I'm really struggling with that, handling clients like in a crisis.
As for crisis situations, when a client may be experiencing an anxiety attack or having a severe anger or emotional outburst, I think it's important to reflect on how you actually respond. It sounds like you believe that sometimes you become stuck and you don't know the right things to say, but how are you actually responding? Are you actually effectively responding to the situation, to the incident? Are you connecting them with emergency services and resources if they do present with imminent danger? Is it that because it's a crisis situation that does typically produce different emotions for counselors, that you are perceiving that you are stuck, but are you actually stuck, or are you responding? How are you assessing the situation? Are you appropriately assessing if there's imminent danger, or if a client presents any risk to themselves or others? I think that if you're doing that, you are actually effectively responding. But I think that you have to actually reflect on the situation or your sessions and actually notice how you respond. What are your actual responses in comparison to how you perceive your response to crisis situations?
So in my work with kids, I'm just really, sometimes I start running out of ideas for interventions or what direction to go with. How do I incorporate something fun? And then it's like with the teenagers, it's so easy sometimes with the teenagers to just sit back and just talk, have a conversation, than it is to always try to have such a structured session. But sometimes I feel like I'm running out of interventions, especially when you have a client that has PTSD and you want to work out the trauma. But a lot of times I feel like I'm not addressing the trauma. How do you go about addressing or getting a client to effectively address their trauma? What kind of interventions can I use that are pretty kid friendly or, teenager friendly, that'll get them to open up, address, and then be able to deal with that trauma that they're dealing with? I'm having a hard time with that aspect of the case.
Well, it sounds like you are doing a great job with navigating, working with the youth, children, and adolescents. And sometimes unstructured sessions are more beneficial. It depends on what your therapeutic approach is. For a person that tends to be more person-centered, if a client comes in and has a desire to talk and guide the session with what they believe is currently causing distress or is the presented need at the time, it is appropriate for you to simply engage them in talk therapy where they guide the session. As far as being creative with interventions. What do your clients like? There are a lot of different approaches and techniques that will allow you to be more creative. Maybe incorporating some art-based therapeutic techniques may be appropriate for some of your clients, or if they're younger, more play therapy. I encourage you to do research creative interventions for youth and adolescents, and try them out. Sometimes it's trial and error, and see what works best for your individual clients. As for addressing a client's trauma, I would ask, what are you noticing in the session? How is that trauma or the impact of the trauma presenting in session? I believe this will be a great guide to helping you to choose specific interventions. Are they presenting with some of those symptoms that lead you to believe that you need to assist them with coping in the moment? Are they having flashbacks or intrusive thoughts? Or, is the trauma resulting in any suicidal thoughts? With that, I do believe that you are correct in using certain techniques such as grounding. I believe that you are questioning narration or narrating trauma. And research shows that you don't always have to have a client to narrate your trauma in order to effectively help them to deal with or address their trauma and how their trauma is currently impacting them.
Also, one of my personal things that I'm struggling with personally is me feeling like just because my client had another emotional outburst or an anxiety attack or a suicidal ideation, that I'm not doing my job, or that I'm not teaching them the right stuff, or that it's going to reflect badly on me. Well, if they're not using their coping skills, are you teaching them the coping skills? And it's I am teaching them. So I have a really hard time with trying to navigate the fact that my client may or may not always be perfect, and I have to really think about that. And it's not a reflection on me per se, I guess, if my client does have another reaction, but personally then I find myself maybe angry at the client, almost drained with the client, and almost to the point where I don't feel like anything I can do is going to work, so why do I care? And that's something I'm really struggling with. It's if you're not going to listen to me, why should I care? And especially with working with children and the parents, if the parents never going to change, then why do I care? So I'm having a really personal conflict with that, that I'm really trying to work out.
So I hear you say that sometimes a client's needs or lack of change leads you to question your effectiveness as a counselor. How do you believe that impacts or reflects in your sessions with clients? Do you believe that that creates some type of flaw in your ability to implement interventions? And I also hear you say that sometimes you feel as if you shouldn't care because you interpret that the client doesn't care when you aren't seeing change, or when they have another anxiety attack, or the symptomology continues. As a counselor, do you believe that, we are solely responsible for a client's change? Have you assessed, the severity of their needs? Have you given them time to actually be able to develop the skills or implement the strategies that will be best effective or most effective in actually resulting in progress towards their therapeutic goals?